The United States spends more on healthcare than any other nation. The sheer amount of money funneled into the system is staggering, yet the benefits are not as evident as one might expect. Yet, its health outcomes lag behind. Despite the enormous expenditure, Americans often find themselves sicker and living shorter lives compared to citizens of other developed countries. This disparity is a crisis. Emergency rooms are overwhelmed, and patients face long wait times, adding to the stress and anxiety of those in need of urgent care. Americans pay dearly for healthcare, but the results are often subpar. High medical bills can lead to financial ruin, forcing families to make tough choices between healthcare and other necessities. The system is failing its citizens. Protests and public outcry are common, as people demand a more equitable and efficient healthcare system. The high cost of healthcare creates a ripple effect. It strains the economy. It burdens businesses. Small businesses in particular struggle to provide adequate health insurance for their employees. It cripples individuals and families with debt. Many are forced into bankruptcy, and the stress of mounting medical bills can take a toll on mental health. Despite these high costs, the U.S. lags in key health indicators. Life expectancy is lower. Infant mortality is higher. These statistics paint a grim picture of the nation's health. Chronic diseases are more prevalent. The system is broken. The prevalence of chronic illnesses like diabetes and heart disease highlights the need for a comprehensive overhaul of the healthcare system. Millions of Americans are uninsured. Many more are underinsured. They face a stark reality. Healthcare is a luxury they cannot afford. The consequences are dire. Without insurance, routine checkups are impossible. Preventive care is non-existent. A simple illness can lead to financial ruin. The fear is constant. The underinsured fare little better. High deductibles and copays make healthcare inaccessible. They delay care, they forego medications, they make impossible choices. This is not healthcare. It is a system of survival, a system that leaves its most vulnerable citizens behind. High costs should mean high quality. This is not the case in the U.S. healthcare system. Preventable medical errors are alarmingly common. Care can be fragmented and poorly coordinated. Patients are lost in the system. Communication breakdowns occur. Medical histories are incomplete. The consequences can be devastating. The shortage of healthcare professionals exacerbates these problems. Nurses are overworked. Doctors are overbooked. Patients suffer. The system is failing to provide safe, effective, and compassionate care. This is unacceptable. Section 4. Systemic inequities. Racism's impact on healthcare. In this section, we delve into the profound and pervasive impact that racism has on the healthcare system in the United States. Healthcare disparities are a stark reality in the United States. These disparities manifest in various ways, affecting access to care, quality of treatment, and overall health outcomes for minority communities. Systemic racism and discrimination permeate the system. This means that from the moment a patient seeks care, they may face biases and barriers that others do not. Access to care is not equal. Many minority patients find themselves in a position where they cannot get the medical attention they need when they need it. Quality of care is not equal. Black Americans, Hispanic Americans, and Native Americans often receive substandard care compared to their white counterparts. These groups face significant barriers, including language differences, cultural misunderstandings, and outright prejudice. They are more likely to be uninsured. This lack of insurance means they are less likely to seek preventive care and more likely to delay treatment. They are more likely to experience discrimination. This can lead to mistrust in the healthcare system and reluctance to seek care. They are more likely to suffer from chronic diseases. Conditions like diabetes, hypertension, and heart disease are more prevalent in these communities due to a combination of genetic, environmental, and systemic factors. These disparities are unacceptable. They are the result of centuries of systemic racism and oppression. They must be addressed through comprehensive policy changes, community engagement, and a commitment to equity in healthcare. Section 5. Navigating the labyrinth, the complexities of insurance. The United States insurance system is a labyrinth. It is complex. It is confusing. It is designed to maximize profits, not health outcomes. Patients are caught in the middle. Navigating the system is a full-time job. Patients must understand complex plans. They must fight for coverage. They must appeal denials. It is exhausting and demoralizing. The system is designed to fail patients. It is time for a change. Section 6. A call to action advocating for change. The United States healthcare system is broken. It is plagued by inefficiencies, high costs, and unequal access to care. Many people are left without the necessary medical attention they need. It is time for a fundamental transformation. We need to address the root causes of these issues and implement comprehensive reforms that will benefit everyone. We need a system that prioritizes patients over profits, a system where healthcare workers are supported and patients receive the care they deserve without financial burden, a system that provides universal coverage. Everyone, regardless of their background or financial status, should have access to quality healthcare services, a system that is equitable and just. We must ensure that all communities, especially the marginalized, receive fair treatment and opportunities for better health. This will require a collective effort. Communities must come together, share their stories, and advocate for the changes they wish to see. We must demand better from our elected officials. They need to hear our voices and understand the urgency of the situation. We must hold insurance companies accountable. Their practices often prioritize profits over people, and this must change. We must raise awareness about these critical issues. Through education and advocacy, we can inform the public and build a movement for change. Change will not come easily, but it is possible. With determination and persistence, we can create a healthcare system that truly serves everyone. We must fight for a healthcare system that works for everyone. This is not just a political issue, it is a moral imperative. The lives of millions depend on it. Our collective action can make a difference and ensure a healthier future for all.